Hi. So lots of questions about the My Best Skin Package Summer Edit. So I thought what I would do is maybe choose some common questions and then answer them for you. So feel free to tap on until you find something that's relevant for you. Right, first one has to be active acne. So sore, inflamed, pustule, tender to touch, difficult to manage at home with product. We would definitely recommend having the Fotona Active Acne Laser Treatment. So 2 different lasers used in 4 different ways in order to fight inflammation, kill bacteria, promote healing, reduce redness, improve skin barrier, reduce oil production. So definitely 3 active acne laser treatments for those patients. Next up is one we see a lot. So early 30s, noticing the first signs of aging, maybe some fine lines and wrinkles, maybe not quite so happy with the skin texture, maybe a little bit of sagging here and there. You would then really be looking at the collagen banking treatment. So laser collagen banking to stimulate collagen production in the skin, maintain your youthful appearance, maintain the texture and the plumpness and firmness to the skin. So you could potentially think collagen banking for all 3. Or if you have some textural issues, like maybe the pores are a little bit less refined than they used to be, you could do 2 collagen bankings and then a lovely laser cold peel, which is very quick recovery, super results for rosacea, one of my personal favorites to treat, just because you can really see the relief for the client when they've had their treatment and everything's much calmer, much easier to manage. So the laser rosacea protocol is excellent, reduces inflammation, helps to repair the barrier, helps to reduce redness, reduce flushing. So 3 of those is a great shout for rosacea clients. And actually, if you're clever, then you would do 6 and then use them for times when you might have a flare-up. So often rosacea patients, they will know that they're coming up to a flare-up, and then you can come in, have a quick session, and then it will reduce the amount that the skin. So pigment in the skin, that's a big thing obviously this time of year. There's a great meso peel called Mesoestetic, which we use a lot to treat pigment. So 3 of those would be a brilliant treatment plan. Or if you feel like your pigment's sitting slightly deeper, as in you've had it for quite a long time, and maybe it's caused by hormonal issues, then you could consider one Mesoestetic and then a couple of microneedlings with pigment reducing actives, and that would be a nice treatment plan as well. Or you could do 3 microneedlings if you feel like it's very deep, and maybe you have a little bit of melasma as well. That's a great treatment plan for that. Pigment's a big thing this time of year. Hope you're all wearing your SPF. I know I'm putting mine on religiously. And last but most definitely not least are our over 45 ladies. I'm right there with you. I would suggest maybe throwing everything at it and doing a collagen banking session, a cold peel session, and a laser eye lift all together in one sitting. That is basically a laser 4D facelift. So it's a great time to do it because it's obviously much cheaper than it normally is, and it gives a lovely result. I will warn you that once you've had one, you will want to have some more. So just be prepared. It's time to invest.